and I are going to do the best we can to get you all the latest and greatest. We had a discussion this morning. He and I had a discussion this morning about the latest vaccine. So the Johnson & Johnson vaccine looks like it's going to get its approval on Friday of this week for emergency use authorization. There's another one that's made by a company called Novavax that looks like it's maybe about a month or so away, that has some really good promise as well. So we'll try to include as much of that stuff as we can. And we will certainly make the slides available to you all after the presentation, either through the AME website or get it sent out to you. So with that, we'll get started. So for those of you who don't know me, my name is Alan Obringer. I am the president of Guardian Pharmacy of Orlando. I am joined today by Michael Samarkos, who is our regional clinical and consultant coordinator for Guardian Pharmacy. So he covers both Central and Western Florida. We're going to split this presentation up and kind of bounce back and forth a little bit. We're going to hopefully really spend more time talking about the vaccines and how they work and some of the stuff that you may not know. But we do want to start today with just a quick overview. I mean, we're more than a year into this. Unfortunately, I saw yesterday as we crossed the 500,000 death mark, it also marked the anniversary of the first person in long-term care to have passed from COVID. So it's, it's a reality we've been living with for more than a year, but we're going to go through the overview there. Michael's going to talk to you about how this particular vaccine works. And then really what we're going to talk about at length is the most common questions. We're going to touch on some of the new variants and things like that. But as I said before, we encourage you to use the Q&A function if you do have a question. We try to answer them, in the middle. If they are appropriate to what we're talking about, it's actually a little easier for us to just kind of answer them as we go along. So don't feel like you're interrupting. If you got a question, ask it when you do, and we will try to get to it. And then, like I said, there'll be some time at the end for any additional questions you may have. So just a real quick overview of COVID-19. It is a respiratory illness. It spreads, again, as you would anticipate, through the air, coughing, sneezing. That's why we're doing all of the precautions of wearing masks, the social distancing, all that kind of stuff. And it's obviously a high risk for the elderly population when you talk about patients that have COPD, when you talk about patients that are already at risk for adverse outcomes from things like the flu. Adding another respiratory illness to the fold here is something that certainly is concerning, and we've obviously seen difficulties over the last year. It's important to note, some of the common symptoms: the cough, the fever, the headache. We're going to talk about these in a little bit more detail a little later on. That loss of taste and smell, or both, or either, is obviously something that's unique to COVID. And one of the things that we've struggled with as a country is, symptoms usually are present within about 4 or 5 days after being infected, but they can take up to 14 days. So that's why when you're quarantining, that's the reason for the 14-day mark for a quarantine person, is because at that point in time, you should see those symptoms and know whether or not you can be infecting others. So with that, Mike, I'll pass it over to you, and you can start talking about how the vaccines work.
All right, thank you very much, Alan, and good morning, everybody. Thank you for attending. So vaccines, right? They've been around for quite some time. We've had really good success with other diseases that haven't really been, that have been pretty much eradicated. Smallpox is an example, polio, mumps. These are diseases that as children now we're all vaccinated against, and they've pretty much been controlled and removed from our population. So how does a vaccine work? Just a quick review. It pre-exposes your body to a small amount of antigen, a small amount of something that causes you to have an immune response. This immune response naturally creates antibodies, and these antibodies kind of target whatever this antigen, whether it's a virus or a bacteria or part or all of one of those items. And what it does is it helps your body identify a foreign substance, and then helps the cells in your body, your white cells, basically target those substances and get rid of those substances. So the current options are the Pfizer vaccine. That was the first one that was out, and the Moderna vaccine was closely thereafter. Like Alan said, the Johnson & Johnson vaccine is soon to come, according to the FDA, possibly, I think, by the end of the week is what I read. And Novavax has another vaccine in the pipeline. AstraZeneca is approved already in Europe. It's not yet approved in the United States. So there's options out there that are being used, and quite successfully, actually, in helping to control COVID-19 and get the pandemic in general for the world under control. So I think there was a question already about mRNA vaccines. Is that what I saw that popped up, Alan?
The question was really more towards, are we going to have to, is this going to become a seasonal vaccine versus one that you just get once and then you're done with? So
I think the jury's still out on the seasonal vaccine. It depends who you talk to, what guidelines you look at, and everything is changing, and it's been dynamic up to this point. I think the variants that they're identifying now have shown the need that maybe it will be an annual vaccine. They're trying to determine how long your antibodies that you create from vaccines will actually last in our bodies. All this is unknown because this is something new. We don't know the answer to some of these questions. There was the Pfizer and Moderna vaccines, or mRNA-based vaccines, which is a new technology. And, new technologies, some of us are a little skeptical of new technologies. Well, others of us, are excited about new technologies. And we're not here to tell you how to feel about it. What we want to do is let you know how they work. So each of the vaccines that are available currently, which is the Pfizer and Moderna, are mRNA-based vaccines. And what they do is they have mRNA within the vaccine that is absorbed into your cells and causes an immune response. Now, the AstraZeneca and Johnson & Johnson are adenovirus-based vaccines. So what's the difference between those two? The mRNA vaccines, the Pfizer and Moderna vaccine, don't use another virus to basically infect your cells. They have the mRNA piece of the virus that they are telling our own bodies to create an antigen for, and it's absorbed into our cells, and the antibody forming process begins shortly thereafter. AstraZeneca and Johnson & Johnson have an adenovirus that transports this same mRNA material into our cells, and the same process occurs after that. So really, the reason it's new technology is because the older technology used a virus to basically transport the mRNA material, where the new technology transports the mRNA material directly into our cells. So vaccine ingredients, there's been some instances of allergic reactions to the vaccine ingredients. I read an article today, the CDC put out some information of the almost 14 million vaccine doses that have been given. There have been 62 documented anaphylactic reactions. So again, anaphylaxis happens. It can happen with other things. It doesn't just happen with COVID vaccines. We all, as healthcare providers are aware of that. It's suspected that the polyethylene glycol component of each of these vaccines is probably what's causing some of these anaphylactic reactions. But again, things are kind of new, so we're still gathering information, and it's unknown. What we can see from the Pfizer and Moderna ingredient list is the Pfizer vaccine seems to have a little less mRNA. The Moderna vaccine seems to have a little more RNA. They both contain lipids. They both contain cholesterol. Why is that important? Well, that's lipids and cholesterol are substances that your cells can absorb. So that's the vehicle to help get that mRNA information into the cells where it does its job and creates an immune response in our bodies. So again, if you look at the list of vaccine side effects have been, a big discussion. They occur with all different vaccines. Again, in that article I read this morning, the CDC has come out and said that the main side effects that they have seen documented are headache, fatigue, and dizziness. So again, if we look on our list, they're all there: headache, muscle pain, joint pain, feeling unwell. All those things happen when we get sick. Well, when we're stimulating our immune response to create antibodies, it makes us feel sick. And it would kind of make sense that all of these side effects happen as our body is gearing up to fight a disease. And fortunately for us, it's only gearing up to fight a little portion of this virus and recognize that little portion. So it doesn't last very long. It's been about 24 hours or so that these side effects last. There have been plenty of reports that the side effects are much worse after the second vaccine as compared to the first vaccine, the second vaccination dose as compared to the first vaccination dose. I have know plenty of people in the healthcare community that have corroborated that as well. It's one of those things that's going to happen. When we get a flu shot, we also get side effects. This is a really great chart that kind of shows you the incidence of side effects comparing the Pfizer and Moderna vaccines to Shingrix, which is a vaccine that's been around for a while and has done really well in helping older people, and with the flu vaccine as well. And what do we see? We see they all have similar side effects. Shingrix has even, a higher incidence of, say, redness and swelling, or maybe Moderna has a higher incidence of headache and fatigue and chills. But if we look at these percentages, though some are different than others, they're all significant percentages of occurrence. And, to me, it's reassuring to know that, geez, these vaccines all work similarly, and we know they're working because they kind of don't make us feel good. And it's nice to see that they kind of share similarities in responses and similarities in side effects. And it's been reassuring to me. It's a slide that I refer to more often than not. So we talked about the new vaccines that are coming out. We've touched already on the different variants of COVID that they're recognizing now. There's information that's come out about particular strains in different countries and how some of the vaccines are more effective in some countries than in others. What we can see overall is the Pfizer vaccine after the first dose is a little over 50% effective, but after the second dose, it's about 95% effective. That's give or take based on a couple of the variants that are out. The Moderna vaccine is a little more effective after the first dose, and then it's up to around 94% effective after the second dose. Does that have to do with Moderna having more mRNA in its vaccine in each dose than Pfizer? One could speculate. I think, what we can see from the chart regarding Pfizer and Moderna is that they're both effective. The AstraZeneca vaccine, which is the European vaccine, is 70% effective after the second dose. And Johnson & Johnson, which, as we mentioned already, will be approved in the United States here shortly, is a little over 70% effective in the United States and somewhere around 65 or 66% effective overall, including the other variants. As a side note, the Novavax vaccine that's coming out is already being adjusted to cover some of the variants that are available. And I think what we're going to see is these vaccines start rolling out and there's more and more manufacturers, they're going to be able to adjust to the variants of COVID that have been identified to make these vaccines more effective overall.
And Mike, before we move on to the variants that you're talking about, there was a question that came in just so you can clarify what you said. You talked about the side effects, and when you're experiencing side effects, you know that the vaccine is working. The question is, if you don't have side effects, does that mean the vaccine is not working?
The answer to that is no. What our immune systems are all geared differently. An older person, and a lot of people in our long-term care communities that have had vaccinations have had zero complaints, that they didn't feel well or anything, but they are covered against the disease. And we've even had some facilities that have had the first dose of vaccine, had an outbreak in the facility of COVID, where many people that had their first dose of vaccine ended up testing positive, but were never symptomatic. So that's really positive news. And then we have not had any reports of any of our facilities that have had the second dose of vaccine have any outbreaks in their communities. Now, that as far as the side effect profile goes, talking to the same people in the same facilities, as far as staff, they have mostly complained of the side effects that we went over. So a younger person's immune system may rev up a little bit differently than an older person's immune system. And some people's immune systems respond differently than others. So no, it's not, the vaccine is absolutely working if you have side effects. So I hope that answers your question. So we've touched on some of the variants already. The three major variants that have been hot topics recently are the UK variant, which is B.1.1.7, the South African variant, which is B.1.351, and the Brazilian variant, which is P.1. I know there's some other variants around. I read about a California variant recently. And I think as we get further along in our struggle with COVID-19, we're going to learn more. And I think part of the idea of picking up these variants and learning about them is, what effect is that going to have on us? What is it going to mean regarding vaccinations? What is it going to mean regarding effectiveness of vaccinations? And how does the virus itself mutate? We know a lot about, the flu virus and how it tends to mutate, and we do our best to cover for that in our flu vaccines, and maybe that's how COVID is going to end up. I think it's a big unknown. I think we can be thankful that it appears that since vaccinations have started, that infection rates and such have started to decline, and especially death rates and hospitalization rates.
So some really good questions kind of coming in here. So, and this is actually perfect timing, because as we continue with the presentation, we're gonna get into some of the common questions. But Mike, let's take a minute to answer some of these. So the first question that we got was, how does the Sinopharm compare with the other vaccines? I understand that this vaccine has already been donated to some developing countries. Is this drug safe? So the answer is yeah. It's actually been used a lot in some of the developing countries. The study that they did only had about 60,000 patients in it, but it proved to be safe in those. And I want to say the last I read was that the company had done like 40 million vaccinations of it. And it's not quite as effective as the Pfizer and the Moderna. It's in the high 70s, like 78, 79% effective. And they're not, so Mike just went through and was talking about like the South African variant, and then there's a South American variant that's in Brazil. And those are some of the areas where that Sinopharm vaccine has been given. So they're not quite sure yet as to whether or not the decreased efficacy is because of the variants, or if it's just because of the virus. Just the vaccine overall is just not quite as good. But again, when you look and you compare that to what the Johnson & Johnson is testing out to be, it's actually a little bit better there. And again, like I said, they did their due diligence in getting the the vaccine safety stuff done, and then obviously get it out. So, and then Sinopharm as a company just has a unique kind of look at this to try to, help the world population by hitting some of the under targeted areas with their vaccine. So we will hopefully hear a whole lot more about that Sinopharm vaccine as it gets more into the mainstream, but it's looking good so far. The next question, Mike, is if someone takes the first dose of Pfizer and the second dose of Moderna, A, will it work? And then B, is there any additional risk of adverse drug reactions?
So that's actually a really good question. There's actually some studies out now looking at whether it makes any difference if you start with Pfizer and your second dose is Moderna, or if you start with Moderna and your second dose is Pfizer. Those results should be out soon. I don't think there's an actual answer. I think logically we're going to find that, we'll see. In my personal opinion, it probably won't make a difference, but we will find out. I think the idea too behind the mixing and matching is they're studying how it's going to affect coverage of variant. So if a Moderna covers one variant better than the Pfizer does, and Pfizer covers a different variant better, is it better to get both? So I think those results are pending. Hopefully we'll be able to bring you more information to come. And as far as ADRs, by using different brands of vaccine, again, I think that's going to be reported in the same study. I would imagine that they're not any different, but I can't speak to that 100%.
So in the last one, before we get into some of these other common questions, is what makes the UK and the South African variant spread at a higher rate?
So the vaccines we have currently create an antibody for the spike that's on the vaccine. We've all by this time seen the nice picture of the coronavirus that's covered with all these little spikes that have what looks to be a crown on them, which obviously gives this virus this name to the virus, corona crown. So they're saying that the spikes are mutated. So when that spike is a little bit mutated, then the vaccine doesn't cause our antibodies to recognize the spike quite as well. Therefore, it may or may not be as effective, and that mutation in the spike is what makes it more infective to someone else. They haven't really come out and said if it's more deadly or they have said that some of the mutations are more contagious. I think if you look at the history of some viruses, they tend to become more contagious but less deadly. So it's probably part of the evolutionary process of the virus itself. But again, this is new territory for everybody. So we shall see. Hope to have a better answer for you than that here shortly.
Yeah, and I think the latest I read, Mike, from the CDC is they're still not exactly sure what that exact mutation is that makes it more contagious, but they have shown that it's not any more virulent, meaning it doesn't make people any sicker.
Right.
They're actually looking at maybe these mutations may actually make people less sick, so that they may actually be good. And then a lot of these, they're rigorously testing all the vaccines to make sure that they're covering those variants. And so far, so good as far as that's concerned. And then one last one here before we get into the common questions. Are the first and second doses of the vaccines identical? And the simple answer to that is obviously, yes, they are. You are getting the same exact dose, the same strength, the same everything from the first dose to the second dose. All right, so let's get into some of these common questions. So first question, who should get the COVID vaccine? Well, the COVID vaccines are currently approved for anyone over the age of 16. They are approved for anyone who previously had COVID. We're going to get into that in just a minute. They are approved for high-risk individuals. we always kind of put a caveat in here to say, if you are one of these high risk individuals, if you are pregnant, or if you are a lactating mother, or you are someone that has a poor immune system or some sort of autoimmune disorder, you should check with your physician before you get your vaccine. However, you should anticipate that your physician is probably going to say, yes, you should get it. All right. So always check with them first if you have any of those types of conditions. But like I said, you can anticipate they're probably going to say, yes, you should get that vaccine. And again, if for any other reason you're unsure, you have some weird disease that no one else really knows about or whatever, check with your doctor first. But what we are seeing, and Mike and I are seeing this in practice, is more times than not, the physician is saying, yes, absolutely, get the COVID vaccine. It is safe for you to take, and it is better than any kind of increased side effects or anything like that you may have. So, who should not get the vaccine? Well, if it's approved for anyone over the age of 16, obviously the one group of people who should not get it is anyone under the age of 16, right? And if you've had an anaphylactic or serious allergic reaction to any of those vaccine ingredients that Mike talked about a little bit ago, those are folks who really should consider not getting the vaccine. And, as Mike talked about, these are kind of new technology vaccines. So, the chances that you are allergic are low. And every vaccine clinic that's out there is prepared to help you should you have a anaphylactic reaction to this. I have not seen anyone or any anaphylaxis reactions that have not been able to be treated. EpiPen, some Benadryl, that kind of stuff over the course. So I've not seen any bad outcomes from any of that. But obviously, we are always on the lookout for them at any vaccine clinic that you go to. Even the drive-through clinics, they have you go and sit in your car after you get the vaccine for your 15 minutes and tell you to honk the horn if you start to not feel well and give you all the list of symptoms and such. So they're ready for whatever may happen should you have an allergic reaction. Who should wait to get the vaccine? And this is kind of important. Hopefully you all have seen that the monoclonal antibody treatments out there. There are a few different options. If you are someone who got COVID and had the monoclonal antibody infusion done within the past 90 days, you should wait 90 days after that infusion before you get the COVID vaccine. All right. So it's not that you shouldn't get it, it's just that you should wait that 90-day period. If you've had another vaccination, and again, we're getting towards the end of flu season here, but so if you just got your flu shot yesterday, you should wait about 2 weeks before you get your COVID vaccine. And the reason for that is just pretty simple. As Mike mentioned before about, everybody's immune system is a little different. We don't want to overtax your immune system by telling it, hey, create antibodies to this flu strain. And while you're doing that, create antibodies for the COVID-19 strain. So, allow your body to fully accept the vaccine you got, wait the 14 days before you get the COVID vaccination. Why should I consider it? And Mike and I have spent a bunch of time with our facilities trying to encourage them to, and their staff, residents and staff, to get the vaccine. We certainly encourage any of the folks that are attending today that if you've not already gotten it, we hope that you will. Our goal today is to just provide you with education so that you can make an informed decision, both on behalf of your patients and on behalf of yourself. But again, I would be remiss if I didn't say that we are both encouraging and pro-vaccine at this point. So we encourage you to do it. But again, we want you to make sure that you are making your own decision. So, why do we need to do this? Hopefully this kind of goes without saying. If we are going to see an end to the pandemic and we are going to return back to some sort of normalcy where we get a chance to not have to wear masks everywhere and be able to gather in crowds or go to sporting events, whatever it is that you are wanting to do, this COVID vaccine provides us a pathway out. We need about 75% of the folks to get vaccinated in order to reach that herd immunity. And we're going to talk herd immunity in just a moment here. And remember, there are folks that can't necessarily get this vaccine. So we want to make sure that we're doing our part to protect them. If we can get to herd immunity, the person who can't get it, they're going to become immune because, again, the virus is going to go away, and we will hopefully be able to get rid of it. There really isn't a cure at this point. There is treatments. The monoclonal antibodies treatment has proven to be to work pretty well, but it doesn't work for everybody. Obviously, here in this country, we're at 500,000 deaths. So, without a cure for this, the vaccine is the next best way out. I think I saw a couple questions come in. Anything that we want to address, or should I move on to herd immunity here?
I think there was a question. One of the questions was, I have a serious anaphylactic reaction to sesame, I believe. I am a health professional. Should I get the vaccine? And the answer to that is, having a serious anaphylactic reaction is one of the cautions that they list, more specifically with the Pfizer vaccine. But they do say if you've had a serious anaphylactic reaction to anything, you need to use caution if choosing to get the vaccine. Now, to Alan's point, every vaccine clinic and most facilities that we service have EpiPens and Benadryl available. So I think it's a discussion too. I know it says you're a healthcare professional, but I think that's going to end up being a further discussion to have with your own doctor. The second question is, have you both had the vaccine? If so, which ones, and what was our side effects? I'll let you talk about our vaccine experiences, Alan, because we have it's been
yes. So we have been part of the wide adventure of trying to obtain vaccine for our customers and our patients and the healthcare workers, and we have not had any success to this point. The most recent that we have heard is that we should be able to order the vaccine as of March the 3rd. Our concern with the beginning portion of this was, when the Pfizer vaccine was the first one to be available, we at the pharmacy did not have any way to keep it in the ultra cold storage. And I will point out the fact that Pfizer is now testing to see if it doesn't need to be in ultra cold storage. It can just be frozen like the Moderna vaccine. I personally have not. I am waiting till we get the vaccine here at the pharmacy so that I can immunize myself and the rest of the staff here. I will say that my personal experience is that my dad, who is 75, has gotten both doses. He got the Pfizer vaccine, and he had both doses of the Pfizer vaccine. I, in a joking fashion, texted him if his arm has fallen off or anything like that. He has had zero side effects from either dose. So the first dose, no problems whatsoever. Second dose, no problems whatsoever. He said the only difference between the two was he felt the second one a little more, but that could very easily just be attributed to it was a different person administering the vaccine the second time around. As Mike mentioned before, we've in our facilities, through the state-sponsored program through CVS and Walgreens, they have done, and now through CDR McGuire Health, they have done a number of COVID vaccines. We have not had anyone that has had a side effect that has lasted past 24 hours. So we've had folks that have had sore arms and some other kind of flu-like symptoms like Mike mentioned earlier. But the most anyone's ever had to do is take a dose of Tylenol, and those symptoms resolved in the matter of hours. And nobody really had any, the worst one, Mike, was one I think we had. It was a morning vaccination. They weren't feeling well. They went to bed that night. They woke up the next day, and the side effects had resolved. So
yeah, there was quite a few reports that I've gotten, especially after the second dose, of just being tired. That was really a common thread in in the folks that I know that have been vaccinated, especially after the second dose. They just felt like they were wiped out for a day or so. So we have another question. How long should one wait before getting another vaccine such as Shingrix? 2 weeks or longer? And the answer to that is yes, 2 weeks or longer is the recommended time period, as well as if you've had a vaccine prior to COVID, make sure it's at least 2 weeks. It's been 2 weeks since your whatever vaccination you had prior to getting your COVID vaccine. And then the last,
I would sorry to interrupt you. I would just add to that.
Okay.
Most of what I've seen is that once you've had the first COVID vaccination, they want you to just wait until you get the second COVID vaccination and then the 2 weeks after that. So if you're the Moderna and you got to wait 4 weeks, once you're in the cycle of I've gotten my first COVID vaccination, they don't want to stress your immune system out with another vaccine. So get the second dose 21 or 28 days later, whichever one you got, and then wait a couple weeks after that.
And the last question is, since the COVID vaccines are not live vaccines, which one may be better for organ transplant recipients? I think that was on one of, or touched on with one of the slides you did earlier, Alan.
Yeah, so the mRNA vaccines are the ones that are more recommended. So waiting for the Johnson & Johnson or any of the adenovirus ones are. It's not to say that you couldn't get those. It's that those are not as recommended as the other one. But again, anyone who's on immunosuppressants or had an organ transplant or anything like that, 100%, you absolutely positively must talk to your doctor first. But anticipate that they would probably steer you towards the Pfizer or the Moderna vaccine in those cases. All right, so let's talk about herd immunity, and hopefully if you are in front of a computer here, you can kind of see the graphic here, and you can see how herd immunity works. As we increase the number of people that are vaccinated, the spread slows, and it's really at that 70 to 75% where there's a pretty dramatic drop off of spread. All right, so and again, the graphic does a better job than I can do describing it. At 0%, we're eventually all going to get it. Basically, at 25%, it's still pretty red throughout. At that 75%, it's pretty specified who may or may not, come in contact and get it. And then if we can get up to that 90%, 95%, there's really very, very, very low risk of anyone getting it. And I know we talked about it before, but some of the seasonal vaccination questions, whether we're going to have to get COVID vaccine every year or not, really depends on how many people get vaccinated and how quickly that happens. Because if we can get to herd immunity, that may make it so that we don't have to get vaccinated every year for COVID. But if we can't do that fast enough, maybe we have to get vaccinated 2021, again in 2022, and but then maybe not going forward after that. There's a lot of variation to answer that question, and the answer is we don't have the answer just yet. So what if the vaccine makes me sick? We do try to be upfront and honest. Although we've had a lot of folks that have not had any side effects, you should expect to have some side effects. I know Mike showed you that the percentages are pretty standard with all the various vaccines. I do want to make sure that we point out the fact that the chances of while it's the same or similar to Shingrix or the same or similar to the flu vaccine, it's still very likely that you're going to have some sort of side effect, whether it's a sore arm, redness, swelling, something like that. That does indicate there is an immune response. If you don't have it, again, we mentioned before, it doesn't mean that you're not having an immune response. But like I said, Tylenol is usually the answer to if you're able to take Tylenol to help resolve some of those. I do want to make sure that I point out, you should not pre-dose. So you need to wait until you have the side effects before you take the Tylenol. Do not take the Tylenol prior to getting the shot. All right. So wait to see if you have the side effects first, and then go about treating them versus trying to be preemptive. And you can, and it has shown that you can see those side effects for up to a couple of days. I know we've talked about 24 hours. It can be 48, it could be 72. We haven't had anyone that personally that has experienced that, but it can make you sick at least a couple of hours following. So how do you know if symptoms are related to the vaccine or side effects from the vaccine? Well, there are certain things I mentioned early on about the loss of taste or smell. That is virus related. All right. So if you have lost your taste of smell, that's not going to be caused by the vaccine. If you have a cough, if you have a stuffy nose, those are not side effects of the vaccine. Those are virus related symptoms. There are 4 people that I have seen so far. They are all in Oregon, but they are in 2 different parts of Oregon that have had both doses of the vaccine and still tested positive after 7 or 10 days after the second dose. They tested positive for the vaccine. The good news is the vaccine worked exactly as it should have. They were both exposed, or they were all 4 of them were all exposed. None of them were experiencing any kind of symptoms. They got tested because they had direct exposure to someone who had confirmed COVID. And they did end up testing positive. However, they never experienced any symptoms. And that's really the upside of the vaccine is even if you do get the virus, you hopefully, and again, shown by a very few number of cases that's happened in, you hopefully won't have any of the long lasting or severe effects from the virus itself. And of course, the other part to that too is that it's important, and Mike's going to talk about this in just a minute, it's important that we continue as people are getting vaccinated. Just because you've had the vaccine, you're not experiencing it, doesn't mean that you can't be a carrier of the virus and potentially infect others who maybe haven't had their vaccine yet. So if you're experiencing symptoms of the virus itself, you should still go and try to get COVID checked if you can, so you know what the risk is to others around you. If you've already had COVID-19, do I still need to get the vaccine? The answer is yes. As Mike mentioned earlier, we're not sure how long the antibodies last. So get the vaccine. It's going to provide additional safety for you and the folks around you. And the vaccine is actually showing to provide stronger and longer lasting protection than actually having the virus. So the way the mRNA vaccines have been designed is actually creating a stronger immune response than from some of those folks that have been tested that actually had COVID-19. Can I get the COVID-19 from the vaccine? This is a simple answer, and that's no. As Mike described how it works and how it's made, you cannot get the virus from the vaccine, from any of the vaccines that are out there on the market currently. So Mike, before I pass this back over to you, but you want to just check the questions here? Yep,
we have 3 questions. The first is just a follow-up. They didn't hear our question regarding our answer regarding the question if you have anaphylaxis or if you had documented anaphylactic reactions, should you get the vaccine? The answer is you need to consult your provider. You may not be a candidate for the vaccine if you've had a documented anaphylactic reaction. And of course, the other side of that is every vaccine clinic will have an EpiPen, Benadryl, et cetera, in place should an anaphylactic reaction occur. Second question, is the vaccine contraindicated in pregnancy? And I'll let you answer that one, Alan.
So the answer is yes. Pregnancy, the question was, is it contraindicated? The answer is no, it's not contraindicated. If you are someone who is pregnant, you should get vaccinated. You absolutely should check with your doctor first. They are part of the population that should specifically talk to their physician before they do. But just know that the physician is probably going to say you should get vaccinated, even if you are someone who is pregnant or a lactating mother. So yeah, pregnancy, you should still get it.
And then the last question, if someone has been vaccinated and then tests positive afterwards, are they in danger of infecting other people? And
go ahead, Mike.
Well, the answer to that is probably. I think the jury is going to be still out on that. I think as of now, anyone that tests positive is going to be suspect for infecting other people. I did actually have a discussion last night with the physician who was in charge of the COVID response clinic in Polk County. And he talked about patients that were positive for weeks after they recovered from the disease. And, they had struggles. He's also in long-term care. So they had struggles with, what do you do? And do you send that patient back to a facility? And how do you let the other people in the facility know that this patient probably won't make you sick? It's one of those questions where we're going to find that there's no answer yet. The jury's still out. I know there's been some talk lately, and we'll get into it here in just a little bit about masks and the need for masks and getting back to normal. I think it's currently a wait and see, unfortunately. And then the last question we have is, where are those who are under 65 being able to get vaccinated? So currently under 65, you should be a healthcare provider. So in direct contact with patient care, working in long-term care, hospital, doctor's office, pharmacy, etc. Or if you're a caregiver for an older person or someone who is susceptible to the disease, you're also eligible as of now. I think once we go into, phase 2 here, Alan, at least in the state of Florida, they're going to open it up to folks younger than 65. But
yeah, those phase 2, like you just mentioned, Mike, is those caregivers that may be under
Right.
the age of 65. It's not till we get into phase 3 that it really opens up to everybody under the age of 65. So anticipate, that we're going to be in phase 2 for a while. There's still, Florida has its fair share of folks over the age of 65. They want to make sure that all of those folks have had the opportunity to get vaccinated first before they go and open it up to others. And again, just specifically, we are still getting supplies of vaccines. The winter storm there in the Midwest from last week impacted the shipping of the vaccine. So stuff like that's always going to come up. We just need to make sure that we are being responsible with the doses that we have, and that we have enough for all of the groups that we open it up to. So Mike, I'll pass it over to you so you can talk about masking and social distancing.
Perfect. Thank you very much. I think we all want to know, right? Do I still have to wear a mask and social distance after taking the vaccine? It kind of leads back to the question we just had about, what if you're positive after you get the vaccine, et cetera. So I like this slide because it really illustrates what a difference a mask makes. We all want to get back to normal. I personally would love to not be wearing a mask. I'm sure if we were in a room all together and I asked for a show of hands of who wouldn't want to be wearing a mask, I might see at least one or two hands, or probably everybody's hand. I'm not sure, maybe both hands. Right now, the answer to this question is yes. It's important to keep in mind that we might still be able to transmit the vaccine, transmit the virus. Excuse me. And then what we can see really is what a mask does to prevent, a sneeze or singing or talking or coughing, from spreading to other people, as we see whether someone has a mask or does not have a mask on, and the difference of what can grow in a dish. And then really the social distancing part, we've done another talk about that touches on social distancing and the reason for 6 feet. And it's got to do with aerosols. Every time we breathe, every time we talk, every time we sneeze, there's bioaerosols that come out of our body and into the air. And what we can see with with the right side of our slide here is 2 feet away. It's still a pretty significant contamination. 4 feet away, it's a pretty significant contamination. But once you get to 6 feet away without a mask, your risk of a contamination goes down quite a bit. Does the vaccine impact my DNA? The answer is no. So the vaccine is an mRNA vaccine. DNA occurs in the nucleus. DNA actually creates mRNA, and it tells the mRNA tells your cells what to build and what to make. So we are just introducing mRNA that is telling our cells to create this spike protein, which then is going to cause our immune response to that spike protein. So the answer to this question in a nutshell is no.
So a question just came in here real quick, Mike. This person got the second vaccine on 2/5, tested positive on 2/16, no symptoms. How soon should I get tested again? It really depends on what your reason for testing. I know a lot of companies have said, yes, you do, or no, you don't. Really 14 days is the timeline. So 14 days after your positive test, if you are looking to get a clear test to return to work or whatever that may be, 14 days for the next test.
That actually kind of touches on the vaccines themselves. Even after your second dose of vaccine, you're really not fully vaccinated for a couple weeks after that. Some things will say a week, some things will say 10 days, some things will say 2 weeks, and I've seen up to 3 weeks. So it is possible to be infected afterwards. And again, the asymptomatic infections seem to be the case for those people that end up positive after vaccination. So at least, the vaccines are doing the job of keeping folks from getting really sick. There's a question that's come up about the vaccine was made quickly and can I trust it? Well, yes, this particular vaccine was made quote unquote quickly, but scientists have been looking at coronaviruses for a while. We had, if you remember in the early 2000s, the original SARS outbreak, that was a coronavirus. The MERS outbreak a little while after that, which is Middle Eastern Respiratory Syndrome, that was also coronavirus. Ebola, which I just read, they're having a problem with Ebola again, I think in Guinea. Ebola is a coronavirus. So these viruses have been around. They're infective. They're usually pretty nasty, and they've been studied for a while. So Pfizer and Moderna have been studying different types of coronaviruses for years, and they were much closer to having a solution than we anticipated, and unfortunately they had a need to create a solution, and we're in the pandemic that we're in, and then the FDA itself has done a really, even though they have given emergency use authorizations, that doesn't mean they haven't looked at the studies, and the studies that have been done have actually continued in the time interval that all other vaccines have shown to have side effects. So they extended these studies that they did a little longer than normal to be sure that they really could encompass all the side effects and really get good statistics for anything that might happen from being vaccinated. So will the current vaccines protect me from the new variants? The answer to that question is yes, the vaccines will protect you to an extent. We talked about the different variants, the UK and the South African and the Brazilian. We do know that the Pfizer vaccine seems to work well against the UK variant. The Moderna vaccine seems to work well against the UK and South African variant, seems to be a little weaker against the Brazilian variant. We know the Johnson & Johnson vaccines work better in the US than they do on the European variants. So each vaccine is going to have a little different efficacy. Like I think we touched on this earlier. And again, I think as treatments and vaccination schedules evolve to catch up with these variants, either the vaccines themselves are going to change, or they're going to recommend mixing and matching, or if you're going to particular areas. But I think we all know that in the world we live in today, nothing really stays regionalized. So eventually, there will be a broad spectrum coverage for everything, but we're not quite there yet.
Yeah, and I just read an article this morning about the California variant, and that's looking good, that there'll be some good protection from the vaccines there. So Mike, rather than going through the take-home points here, we've gotten a whole bunch of questions and we're short on time here. So with the last moment or two, just want to make sure that we get to everybody's questions. So again, use the Q&A function if you can to ask any questions. We'll try to get to as many of them as we can here. But a few things from various places. First question, will COVID eventually go away in 2 years or so like the other SARS viruses in the past?
Well, the answer to that is we don't know. There has been infection decreases. There's been, hospitalization decreases, and as well as, just documented illness decreases. And this has been worldwide. I think it's 20%, 25%. So relatively significant decreases recently. It seems to coincide with the beginning of vaccination. I've read some studies that say, we're already at herd immunity. I don't know if there's an answer to that question just yet, other than hopefully. And I would love for it to go away, and we don't have to deal with it anymore.
So the next question is, if you've had COVID and you were very sick, but you obviously have recovered, you're obviously going to have antibodies. What's the reason for getting the vaccine, to try, forcing your body to create more immune response when you already have antibodies to COVID from the illness itself?
So, funny, I had that conversation with that physician last night, and he had in his clinics folks that had COVID and then had it again. And the second time, he said they were sicker than the first time. So I think part of the idea of the vaccine is to help your body cope with the disease. I think we all have different immune systems and immune responses. I don't know if that's really a direct answer to your question. The idea we would have is, if we have our own natural antibodies to the disease, we should be able to do a better job fighting it. But it appears that this disease, for whatever reason, and they don't know, again, if it's a variant infection or some leftover from the initial infection when someone gets infected again. But there's quite a few documented cases that the second infection ends up being worse than the first infection. So I hope that answers your question.
So the next one is, how long did the Pfizer and Moderna companies, how long did they test their vaccines before releasing it to the public, and did they test it on humans? So I can answer this one, Mike, okay. And that is, yeah, absolutely. The tests were 70,000 plus people involved, so it was absolutely tested. I think they started, or they released their first wave of phase 1 and phase 2 results back in July, I think early August for the Moderna. So, immediately as soon as COVID started to spread worldwide, they really started to work on this. Now, they've had the mRNA technology, they've been working on it for quite some time. So that's really what shortened the research and testing period and helped us get a vaccine much, much faster than, normally it takes years. Obviously we've had a vaccine in less than a year with this, but yeah, absolutely. It was tested to be safe. It was then tested on large groups of people. What I read the other day, actually, interestingly, is there are a couple of studies that are trying to get approval where they want to vaccinate individuals and then intentionally expose them to the virus to see if they get sick. So there's lots of testing that was done prior. There's testing that is still being done, obviously, since it's been released. So hopefully that will help, again, continue to provide us with more information and more safety information.
So we have another question here. What's the longest time frame after the initial vaccine dose to receive the second dose? So they have approved actually a 42-day window on dosing now for both the Pfizer and the Moderna vaccine. So Pfizer, you normally needed to get your follow-up dose in 21 days, and Moderna was 28 days. That has been extended to 42 days. And like I mentioned before, they're also looking at studies on mixing and matching different vaccines, as well as the effectiveness of just one dose. Specifically, remember the Moderna vaccine had pretty good effectiveness after just one dose. So, you know, the idea is if we can get a majority of people, you know, 75% vaccinated, then we're all much further ahead than we are today. And we have to remember too, you know, they call it the novel COVID-19 virus because it's new and our bodies haven't seen it before. And unfortunately, it makes us pretty sick, or has the capacity to make some of us pretty sick. So I hope that answers your question.
So I know we're a few minutes over here, but Mike, if you have a few extra minutes, we'll make sure that we get all these questions answered.
Oh, absolutely.
So back to the masking, has there been or should there be more effort to provide or require N95 masks to the general population, not just to essential or frontline workers?
So I would refer back to the slide on that showed the Petri dishes, and then the difference in sneezing and everything else with a mask and without a mask, and then the difference between social distancing with a mask and without a mask. I think the jury is out on how much virus it takes to infect someone, because, you know, there's been households, and I know of households where one person was infected, the rest of the household did not wear a mask, but no one else got sick. So they're trying to determine how much virus it takes to actually make someone sick. And it appears that it's not just, you know, one virus landing in someone. It probably has to be more than one. So I think that answers your question. I'm not 100%. Those N95 masks are fantastic, but I think it's going to end up being shown that it's not necessary for everyone to wear an N95 mask. You should wear an N95 mask if you're going to help someone who you know is positively infected. That's to protect yourself. But I think in general, with social distancing and just in our day-to-day, that an N95 mask will probably end up being shown to be overkill.
Yeah, and I would add to that, obviously, their companies are out there just trying to make enough. I mean, it hasn't impacted us. We've had availability of masks. They were hard to come by, things like that, obviously, early on in the process. But there are parts of the country that are still having issues to get those N95 masks to essential workers, frontline workers, healthcare workers. So I don't think that there's really any push that I've seen to provide them to everybody, because we're still struggling to make sure that there's enough for the folks who we know can benefit from them. So I think I agree with you there, Mike. So just a couple more here, and then we'll let everybody go. So actually, Mike, I think you just answered this. You know, COVID-19 is a novel virus, new to everybody. Do you think that with vaccination all around the world, is it possible to eradicate it? How much time, you know, do you think it will take? And, you know, obviously the time amount it's new, so we don't know. But, you know, certainly I think as Mike, you just said a little bit ago, you know, we've seen, yeah, actually, I think we opened this. We've seen viruses of various kinds go away and not come back. You know, that's why we have the polio vaccine. You know, so we've seen this stuff get eradicated. So I think that answers to the question is yes, it absolutely can happen. It's just a matter of how long. Don't know. What's it going to take? Are we going to have to get yearly vaccinations? Not sure about that. So all stuff that we still need to learn here. Next question is, have you been hearing rumors or stories of vaccine doses being thrown away by vaccination teams in Florida for a host of reasons. So unfortunately, the answer is that I've heard all sorts of crazy stories. There was a physician out in the Midwest within the last couple of weeks with their huge storm who got arrested. I kid you not. The story is that he worked at a hospital. They had the vaccine in storage. The hospital lost power. The generator wasn't working properly. That vaccine was gonna go bad. And so he said, rather than wasting it, let's just get as many people as we can and line them up and get them vaccinated. And the state government, and again, they came to their senses after he was already put in handcuffs, but they arrested him for giving non-approved people vaccinations. So I think that there's a lot of stories out there. The folks that we've dealt with, the folks that we've seen, are very, very, very conscientious about not wasting doses. I know that the Walgreens near where I live, they had some extra doses from a facility, and they basically brought it back to their Walgreens and vaccinated folks with the leftover doses that they had to make sure that nothing got wasted. So I have heard of folks stealing the vaccine because they think it has microchips in it and they don't, and destroying it. I've heard of somebody got their truck stolen and they were a transporter of the vaccine. Whether these are valid stories or not, I think we're going to keep hearing crazy stories out there. But I know as a healthcare worker, as someone who is working tirelessly to try to get the vaccine, we have plans in place to make sure that not a single drop of it goes to waste. And I think that that's probably the most common attitude. We have guardians in other states that have been involved since December with the actual vaccinating of people. And I can tell you from their experiences, they have not wasted a single dose. So, hopefully that answers your question. I think we're still going to hear some stories out there. And the last question I see here, Mike, I'll let you answer and then add any closing thoughts you may have, is what are your thoughts on double masking?
So I think that kind of goes back to the N95 question. And again, I like to reference the slide with the Petri dishes and showing that, just with a regular mask, what difference that makes. Double masking obviously could be, I would leave it as a personal choice, because it can only make it better, less able to contaminate others, especially if we're infected. I don't know how much that would keep us from becoming infected, especially if we, again, we're caring for someone that was COVID positive and we had access to N95 masks. So I hope that answers your question.
So thank you, everybody. We appreciate you sticking around with us for some extra time here. We hopefully got to all of your questions. I'm not seeing any more come in. I guess I can advance to the official questions slide here. I certainly appreciate it. Michael, thank you for joining me here today. Just a reminder, if you are someone who is seeking continuing education, if you registered through the AME website, you will get a link sent to you this afternoon automatically. If you did not register through the website, then email Lisa Starnes through AME. Her email address is lisa@medicationeducation.org. It is in the chat, so you can log through the chat and you can see her email in there. And she will send you the link to be able to get CE credits. So again, it's approved for CE credits for administrators, nurses, pharmacists, pharmacy technicians. And again, thank you from myself. Thank you. And Mike, I'll pass it to you for some closing words.
Again, thank you guys very much for attending. Since I'm looking at the question slide, for those of you still in attendance, we did get a good question the last time regarding giving blood after you've had the COVID vaccine, and there's no restrictions. So should that question come up for any of you, it's a question we'll eventually incorporate into this presentation. But I thought it was a real good question, so I wanted to address it today. And overall, thank you very much.
All right. Have a good day, everybody. Thank you.
Thank you for attending. Have a great day.